The health workforce is at the center of every health system. However, many countries are grappling with major health workforce challenges, such as critical shortages in the supply of workers, an inadequate mix of skills in the workforce, inequitable geographical distribution of health workers, and gaps in their competencies, motivation, and performance. That's why the Global Health Workforce Program has been supporting health partnerships in Ghana, Kenya, and Nigeria to contribute to better health workforce management, improve leadership capacity, high-quality education/training activities, and improved motivation, well-being, and retention of the health workforce to build stronger, more resilient health systems for the future. Funded by the UK Department of Health and Social Care, the Global Health Workforce Program is working to build the strength, resilience, and capability of health workforce to advance progress towards universal health coverage in line with Sustainable Development Goal 3.
Because I was trained, what I learned, I'm also passing it on to my residents. So even during money review, when they talk about in the discussion, we bring it up, when they discuss cases, I say this was what happened, then you tell them, oh, next time this is what you're supposed to do. Because of the knowledge, I've acquired the knowledge, I've acquired the skill. So I can now tell somebody that I didn't have the skill, this is the best way to do it.
JC intervention is very impactful in the sense that earlier, before the intervention, we've been doing something, maybe let me put it to say wrongly or ignorantly, like the issue of stereotyping, discrimination. We've been discriminating staff and students, not knowing that it is exclusion or discrimination. But the impacts of the projects have totally changed the narrative, in the sense that whatever we are doing in the institution, we are trying to be a gender transformation.
The Global Health Workforce Program has funded grants to 41 health partnerships across the UK, Ghana, Kenya, and Nigeria. Since the Health Partnerships project inception in February 2024, 6,749 health workers have been trained in leadership, education, clinical skills, and gender equality and social inclusion. Health partnerships have closely collaborated with ministries of health and national bodies to develop interventions, guidelines, and policies which address national needs. In several cases, the projects have provided evidence from the project activities to inform national plans leading to scale up across the country.
We would want to train everybody in leadership because eventually everybody will attain leadership. But initially we want to concentrate on those who are the medical officers and then the community health officers who are heading those facilities, because they will set the pace. If they know what to do and how to do it right, they can guide those who are under their supervision to also do things right. So that's the philosophy of our approach.
The WHO projects a shortfall of 10 million health workers by 2030, mostly concentrated in low and low middle income countries. Health systems can only function with health workers, and realizing the right to the enjoyment of the highest attainable standard of health is dependent on their availability, accessibility, acceptability, and quality. Funded by the UK Department of Health and Social Care, managed by Global Health Partnerships and local grant managers for Nigeria, Dusit Blue Solutions, the Global Health Workforce Program is working to address this gap. We must continue to invest in our health workforce to ensure stronger health systems for the future and to realize the vision of a world where everyone has access to quality health services. After all, there is no health without health workers.